The province is seeing a rise in new HIV infections. From January 1st, 2025 to June 30th, there have been 189 new diagnoses of HIV in Manitoba, and that's nearly double the number of cases in the first 6 months of this year compared to last year in the Prairie Mountain Health Region. Joining us now is the province's Medical Officer of Health and Communicable Disease Control, Dr. Carol Kurbis. Good morning, Doctor.
Good morning.
Thank you so much for joining us. Now, tell us about some of these numbers you're seeing and why they're so concerning.
Well, we've known in Manitoba that HIV has been increasing since 2019, so it's been quite a number of years where we're seeing a rising trend. And particularly since 2022, we've seen quite a few more cases than we normally do in Manitoba, so it's quite concerning to us. In Manitoba, most of the new cases of HIV have been associated with injection drug use and heterosexual sex, and that's a little bit different than what we're seeing in other areas of Canada. So we are quite concerned about those trends and, trying to put in place a number of strategies to try to address that.
When you say that it's different than what we're seeing in other parts of Canada, what are you seeing there and why is it so different?
We're seeing more injection drug use here, and we know that a lot of the HIV cases, the newly diagnosed cases, they also have other challenges such as lack of housing, mental health issues, substance use disorders, poverty. So it's really important that we look at addressing those factors as part of the overall HIV strategy.
Part of the concern is a lot of people might be infected with HIV, not know about it, and then continue to spread it, right?
Absolutely. So testing is a big part of our strategy to try to address this. We're trying to ensure that people feel safe and comfortable in talking to their healthcare provider, asking for testing. It should be part of the regular sexual health checkup when you see your physician or your healthcare provider, and we really want to make that testing accessible to people.
Why do you think there's a difference between Winnipeg's health region and the Prairie Mountain Health Region?
There's really not a big difference. Both are experiencing rises in HIV. So Prairie Mountain Health has seen more of a rapid increase in cases. They've also done a lot of testing. So they may have been identifying a lot of previously undiagnosed cases. Winnipeg is as well, but Winnipeg is also seeing a rise in HIV cases.
Okay, so what are you hoping to do by even just speaking with us today? What is the message you want to get across?
The message is we really want there to be awareness that people should be taking precautions. They should be getting tested regularly for STBBIs as part of their regular healthcare checkups or when they see a healthcare provider. And for those who have HIV, we have really effective treatments now. The treatment, when people go on medication and it reduces the viral load in their blood, it means that they can't transmit HIV sexually and are much less likely to transmit it through injection drug use. So a big part of our strategy is trying to support people who are newly diagnosed, give them lots of hope. We have really good effective treatments, and really support them in taking their medication. That's part of the prevention as well.